Hi everyone, welcome to my Tips and Tricks channel where I share with you ideas for living a copacetic life. My name is Kristen Cole, I'm a clinical psychologist, and I'm here to share with you evidence-based practices for helping you cope with anxiety. I love this quote here related to anxiety. Anxiety is like a rocking chair. It gives you something to do, but it doesn't get you very far. This is from an author, and I think it really speaks to how anxiety typically doesn't serve us well. However, I'm going to show you in this video how it actually could serve you, and most importantly, share with you some tips and tricks for managing it. I'll cover what anxiety is, help you understand its nature, what might be causing it, and then again, most importantly, some tips and tricks for reducing your anxiety. Here's a reality check. In America, we've got a lot of anxiety. Now, there's a difference between anxiety symptoms and an anxiety disorder. When anxiety is at the disordered level, the prevalence rate is about 19% of adults in the country. However, when we look at how many people are reporting moderate symptoms of anxiety, but not necessarily to the degree of meeting the criteria for a diagnosis of a disorder, we're looking more at 33% of the nation. This is for adults. I also want to let you know that current research is showing that we are seeing a significant increase in anxiety. When we look at the difference between males and females and who's really developing anxiety, we see that females report higher rates of anxiety. And the key word here is report. When research is done, we have to think about why somebody might be reporting more than another group. And we typically socialize females in this country to be in touch with their emotions and share their emotions, be more open to speaking about their emotions. So females in research studies are more likely to report emotional states compared to the way that we raise males, where we encourage them not really to be in touch or share their feelings. I also want to point out that the research is developed looking at gender as a very binary, in a very binary way. So when they're doing research, they're asking people to identify as either male or female and really not recognizing that gender is truly on a continuum. What is anxiety? There's everyday anxiety, and then there's what I would call disordered anxiety. Everyday anxiety is the fear and worry we all have. We're all going to go through life experiencing some fears and having some worries. That's completely natural and completely normal. We worry about our job, about finances, relationships, taking exams, doing presentations, life events going on, and dangerous situations. Anxiety is an important emotion that we all need to really value. It's when it's uncomfortable that we start to really hate it. And what I want to try and show you in this video is a way to embrace it and make it work for you rather than against you. Disordered anxiety is when we have really serious, unrealistic, irrational, intense fears, and those fears persist, and it creates a tremendous amount of distress, and it impairs our ability to function in life. And that's really the key thing here, the difference between anybody having symptoms of anxiety, which would be typical and normal, versus a person having so much anxiety all the time is creating such tremendous distress that they're not able to function in life because of it. Understanding the physiology of anxiety can be very helpful when trying to reduce it. The experience of anxiety physiologically is the same as having that fight or flight response when we're in danger. The difference is that when we're anxious, our body kicks into that fight or flight mode, and we don't really understand why, because we don't see any apparent danger in that moment. We might have just been sitting, hanging out, and suddenly, whoosh, our body changes in a fearful, endangered state physiologically, but there's no real danger around us, and that can create a lot of further anxiety because we don't understand what's going on with our body. I think it's helpful to understand this physiology. We have an automatic system within us to kick in when we're in danger. If somebody is following you at night in a dark area and you perceive them as dangerous, Your sympathetic nervous system is going to change your physiology without you even thinking about it. You don't have to think to yourself, oh, whatever shall I do? I think somebody might be following me. Physiologically, your body just shifts and changes. Your eyes change, your pupils become more dilated, your mouth becomes dry, you may start to sweat or even get goosebumps. Your heart rate goes up, your breathing increases, and epinephrine and norepinephrine is released within your brain and your body, and this is really going to increase your heart rate, increase your breathing, your blood pressure, and also increase your blood sugar to give you the energy to deal with that perceived danger. Also, your digestion changes, so if you were hungry before, it's really a non-issue because you're in danger. And this all happens automatically to get you in that fight or flight mode. And you're either going to fight off whoever is following you, or you're going to run away from them. Sometimes we freeze as well. If you realize that the person who is following you is actually your friend and you're not in perceived danger, what will happen is your body will automatically shift into the other side of the system called the parasympathetic nervous system, and that's going to calm you down. So all those things that had changed physiologically are going to go back to its normal state, and you'll feel much calmer. When we look at people in research settings who have anxiety versus people who are actually in danger, their physiology looks identical. You really can't tell the difference between them. So wouldn't it be amazing if somebody is anxious, their sympathetic nervous system kicks in, they're really wound up physiologically, and they would be able to actually push themselves into that parasympathetic nervous system. In other words, voluntarily make themselves calmer. Well, there is a way to do that, and the key here is through our breathing, and that's why I highlighted it in red on the slide here. If we can change our breathing from high and shallow, like when we're in that sympathetic nervous system state, to low, deep belly breaths, it will actually force our system to move into the parasympathetic calmer state. And this is very empowering, and it's one of the most essential tools for managing anxiety, is being able to change your breathing. When you do it on a very regular basis and you teach yourself to do that deep belly breathing, essentially what's going to happen is your brain and your body will realize, oh, this is helpful for me, and you'll start to notice that you're doing that deep breathing when you're anxious and you didn't even realize you were anxious. So it's a really great tool to use. I highly encourage you to learn how to do diaphragmatic breathing, that deep belly breathing. What are the symptoms of anxiety? Like, what is anxiety? We all know what it feels like, but how would you really describe it? Essentially, it starts with the mind. So we're worrying, we have these worried thoughts, and then that shifts all the way down through our core into our body. This is a very strong mind-body connection. We start worrying, we become fearful of something, and then that makes us nervous. That nervousness can create a sense of physiological restlessness within us. We become tense in our muscles, so our arms, our legs, our neck gets tense. We have palpitations, so our heart rate is increasing. We can feel that. We may start sweating, trembling and shaking. We have shortness of breath. This is happening because we are in that sympathetic nervous system state and we're breathing high and shallow in order to deal with a perceived danger. And that can feel like a shortness of breath, just that physiological shift that we have. We may start to feel like we're choking, and again, it's because we're hyperventilating. And we may feel chest pain. Again, that can be because we're hyperventilating, we're tense, we've got these this muscle tension going on, we're worrying, and our physiology is really shifting and changing. So we can feel like a tightness in our chest. Sometimes people get nauseous because they're getting so upset that the acid in their stomach is churning around and irritating the lining. We can be emotionally irritable. It can be hard to focus and concentrate. We may get dizzy. Again, that's because we're breathing high and shallow. And then our blood system shifts and changes, and often when we're in danger, our blood energy goes into our core in order to help us deal with that danger. So we may feel, a sense of chills or heat or cold hands because blood's going to the core of your body to help you. It can create sleep disturbance. Another symptom is derealization, so feeling like you're in a dream state and it's not really real. Depersonalization is having the experience of almost watching what you're doing as an out-of-body experience. That can be a symptom. Paresthesia can be a symptom. This is a tingling sensation in the arms, the legs, the hands. And we can start to worry even more and think, I'm going to lose control. Oh my goodness, I must be dying. Because what's happening is physiologically the body's changing into that sympathetic nervous system state, but we don't know why because we don't have any true danger in front of us. And so the brain tries to make sense of all of these changes. My breathing's high and shallow, it's hard to breathe, my heart rate's going really fast, I'm feeling tenseness in my chest, I've got muscle tension going on, I'm feeling dizzy. So my brain says, let me add those things up. You must be having a heart attack. And it's a logical conclusion, but it's an incorrect conclusion if it's anxiety. And so that worry of, oh my goodness, I'm actually going to have a heart attack, I'm going to pass out, just exacerbates all of this. And so we need to train the brain that our body can handle these kinds of anxious, physiologically anxious states. We may also start avoiding situations if we notice that we have more anxiety in particular situations or with particular people. It's so uncomfortable, we may start to avoid that. So I want to take a moment to ask you to take a deep breath and let it go. What we find is that when we talk about anxiety, or you listen to somebody talking about anxiety, it can increase your anxiety. So just take a deep breath and let it go. You're just getting education, and this is actually going to help you. A few things to be aware of and to be educated about related to anxiety. We are a quick fix society. We want a pill to just snap us out of something and fix it and cure us. And so a lot of people who struggle for many years with anxiety that's at the disordered level will reach out to physicians and say, I don't care what you got to do to me, just give me something to get rid of this anxiety. It's so distressing. I can't function in my life. It feels so horrible. And so they're rightfully seeking out help. You know, they're doing the right thing, trying to get themselves some help. Often the prescription medications that are available for anxiety are in the class of drugs called benzodiazepines. These are sedatives, and they work in that they treat the symptoms. So they will relax somebody physiologically. They'll calm that sympathetic nervous system down so people feel much calmer and able to focus and sometimes better able to function. There are 3 warnings to the benzos that I want you to be aware of. One is we're treating the symptoms, not the problem. So the person will always need those meds as long as they have anxiety. Really, the long-term goal is to treat the problem, not just the symptoms. So treating the symptoms, not the problem. A second warning is that these are medications that could be addictive. We develop tolerance for them. We need more and more to have the same effect. And so there's a potential for addiction. Doesn't mean everybody's going to get addicted to it, but there's that potential. And then the third concern is that it robs us of a deep state of sleep that's really important for us to feel restored, called the REM stage of sleep. And so while I'm not saying stop these medications, I'm not giving you any medical advice around medications, I'm giving you education about them so you can have these kinds of conversations with your prescribing physicians. There are other medications that may be options that don't have these 3 concerns. They're not physiologically addictive, they don't disrupt REM, and while they may be treating the symptoms, not the problem, the goal with those medications would be to help somebody to be able to be anchored enough to learn all the other techniques that are going to be more on the cure end of treating anxiety versus treating the symptoms. So there are medications that we could use in collaboration with treatment. Be sure to be really educated about medications that you take. Be sure to ask your physicians about side effects, read the inserts to these medications, and be informed. I think that's really important for you to be informed. Take that initiative. Another thing to be aware of is that people may numb out anxiety through the use of alcohol or cannabis. These substances do calm us down. They're depressants, and so they will calm us down. Again, we're treating the symptoms, not the problem. I want you to know that anxiety is very, very treatable. Even disordered level anxiety is very treatable. However, not all licensed clinicians specialize in treating anxiety disorders. If you have or someone you know has anxiety to the point where they really want to get professional treatment for it, it's really important to be a wise consumer, to do your research and make sure that you are vetting these people who are going to help you or your loved one, and make sure they really know what they're doing. They don't just know about anxiety, they actually specialize in treating anxiety. Why am I anxious? I encourage you to get curious. We need to rule out some things that look like anxiety but are not anxiety. Caffeine use will trigger the sensation of anxiety, but it's not anxiety, it's stimulant use. Nicotine is a stimulant as well. So if people are using caffeine and people are using nicotine, they could look anxious. They could feel physiologically anxious. However, it's the stimulant within their bloodstream that's causing those symptoms. And so it's really not anxiety, it's those two things. Other stimulants can do this as well. Hyperthyroidism, so an overactive thyroid, mimics anxiety. It looks just like anxiety. So if you think you have anxiety, but really you have hyperthyroid and you do all these things to help your anxiety and it doesn't work, that makes sense, because if somebody has hyperthyroid, they need medical intervention and assessment to be able to treat that. Anxiety treatment's not going to fix or cure hyperthyroidism. Diabetes and heart conditions also can mimic anxiety. These are situations where we need to really rule out the medical causes of these symptoms to make sure that it really is anxiety. It's not these other medical things. Some medications can have side effects that mimic anxiety, and asthma can feel like anxiety as well. When people have difficulty breathing, it can trigger that sympathetic nervous system and it feels like anxiety, but it's actually an asthmatic reaction. So get curious about anxiety. If you're anxious, you know somebody who has anxiety, rather than just judging it, get curious about it. What in the world is triggering this for me? And might it be something medical or substance related that I need to rule out and figure out before I even really address it as anxiety? So let's say we've ruled everything out and it truly is anxiety. What in the world can I do? Here are 25 tips and tricks to help you reduce your anxiety. Number one, get education about it, and that's what you're doing now. So understanding physiologically what your body's doing and how it moves into that sympathetic nervous system can be really calming for your brain, so that when you get anxious again, you realize, okay, this is just physiologically what my body's doing because it thinks I'm in danger, but I'm not really in danger. I'm worrying about something. And your brain and body is so incredibly resilient, it can handle being in that sympathetic nervous system over and over again. We're designed to be able to do that. And so don't stress out that it's going to make you collapse. As long as you're not hyperventilating, that could make you collapse. So you're going to change your breathing and get yourself settled down. So understanding and learning about anxiety like you are right now is a wonderful way to address it. Get curious about it, as I was mentioning. Notice the list of symptoms that I went over with you and identify the ones that are really your key symptoms. The more you understand your symptoms, the better you're going to have control and power over your anxiety. Don't numb it out with substances like alcohol, drugs, cannabis, food, shopping, spending, gambling, gaming. There are many ways we can numb out. And while that may be treating the symptoms, it's really not treating the problem. So beware of numbing out. It's not a good idea. If you're using caffeine and nicotine and you have a lot of anxiety, it would be really important to decrease and ultimately eliminate those stimulants. Now understand that if you're going to decrease these, it's difficult to do, and we often have withdrawal symptoms. So perhaps you're going to do some research on what are the caffeine withdrawal symptoms and how can I reduce those symptoms as I start to cut back my caffeine, or how might I reduce and eliminate my nicotine use in a safe way. You could consult a physician in order to be able to do that. It's also incredibly helpful to exercise regularly. When we continue to exercise 5 to 7 times a week, and it could just be a 10 to 20 minute walk every day, it will actually keep your anxiety at bay. But it takes discipline, it takes initiative to get ourselves out there and do that exercise. It's a really great treatment for anxiety. Deep breathing is going to be my #1 recommendation for reducing anxiety because it will move us from that sympathetic nervous system into the parasympathetic calming system. So that deep belly breathing that I was mentioning, the diaphragmatic breathing, is going to be an incredibly powerful tool for you to use. The beautiful thing about it is you can do it anywhere. You don't need anybody for it. It doesn't cost you anything. You don't necessarily need to close your eyes and get into what looks like a meditative state to do it. You could do it in the middle of an interview. You could do it in the middle of a conflict with somebody. You could do it wherever you are. Do that deep belly breathing to get yourself to settle back down and get that parasympathetic nervous system activated so that you feel better. Relaxation techniques are a great tool to use. Things like listening to music, stretching, guided imagery, all kinds of things that you do to relax, perhaps tensing and releasing your body parts from your head all the way down to the tip of your toes through a progression relaxation exercise. These kinds of things are going to be really helpful for anxiety. And meditation has been shown to be incredibly helpful for anxiety. Again, there are many ways that you can learn to meditate through videos that people post and books that people are publishing. There's lots and lots out there on meditation and mindful meditation that can be very helpful. I want to go back and make one caveat comment about the deep breathing. If you try this deep breathing and you find that you're getting agitated, it's not working at all, what is probably happening is you have too much of that epinephrine or adrenaline that's running through your body. So to sit and breathe or meditate, it's not really going to be an option. It's only going to annoy you. So if you're really physically agitated, you're trying to breathe and it's not working, what I recommend you do is get up and move around. You know, you don't have to go run a marathon, but get your body to move around, walk around the block, walk around your home, get some energy out physiologically. And then after you've walked around a little bit, come back to a sitting position and try to do, or even a laying down position, and try and do your breathing again. But if the breathing's not working for you, don't give up. It's likely that you have too much adrenaline running in your system and you need to get that out first before your body's really going to let you sit and do some deep breathing. Some more tips include distraction. We're worrying about something. This is what's triggering our anxiety. It's our thoughts. I'm worrying. So if I can distract myself from that worry, I'm actually going to settle down a lot. We can do distraction in a lot of different ways. Some people will wear a rubber band around their wrist and kind of snap the rubber band when they're feeling anxious. That kind of snaps them out of that mental worried state. Some people will use the types of fitness bracelets that have options for distraction. Some of those have this option where you can make it vibrate when your blood pressure goes up or your heart rate goes up, and it's picking up on the heart rate increase. It will start to vibrate just to kind of get you to focus. There are different kinds of apps you can put on your phone to help you. So think about what a good distraction would be for you. How can you get your mind off of the worry and focused on something else? A hobby would be a really great distraction as well, as long as it's taking your mind into a different direction. When we have idle time to really focus on the worry of what's going on, that's when our symptoms will get worse. Another tip is for you to do journaling. We're obviously worrying, so dump those worries down in a journal. Just do a data dump and write down everything you're worrying about. Don't judge it. Don't worry about reading it again later. Just do a complete purge of all these worried thoughts. Get them down on paper. Sometimes that releases it from our brain and we can settle down. It's always helpful to talk to somebody, and it doesn't necessarily need to be a professional, but it really needs to be somebody who is trusted and also somebody who's calm. If we're anxious and we call a friend who is super anxious, that's going to make us feel worse. Or if we're anxious and we call somebody who's not very trustworthy, that's going to make it worse because we don't know who they're going to tell about all those worries we just shared with them. So think about in your life, who is a trusted friend? Who is somebody that you could call who would maintain your confidentiality, be supportive, and stay calm in the midst of you not being calm? And just talking to somebody has a really great impact on decreasing anxiety. If you're somebody who's worrying about not being perfect or not doing something perfect, you got to work on accepting those imperfections. We're human, we're not perfect beings, we're going to make mistakes. Making a mistake is not the same as being a mistake. Look at your mistakes as your behaviors and your choices and your power to make changes and to improve in life and really do better, rather than judging them and seeing yourself as a horrible person because you happen to be human and you made a mistake. So try and reduce that push for being perfect. Many of the anxious thoughts start with what if. What if this happens? What if that happens? And what I want you to try and do, if this is you, is imagine a red stop sign, the traffic stop sign that just says stop on it. And I want you to imagine every time you notice yourself thinking, what if, you see this big red stop sign that says stop, knock it off. And try and use a visual tool like that to catch yourself when you go down the what if route. If you continue to do the what ifs and the stop sign's just not working, I encourage you to follow the what ifs with then what. If a person is worrying, what if I fail at that interview? Okay, let's just go down the path. Then what? Well, then if I fail at the interview, I'm going to be embarrassed. And then what? Well, then I'm going to wish I was never there in that meeting. And then what? And then I'm probably going to leave the meeting and think about all my mistakes. And then what? And then I will probably spend time looking at all my mistakes and feel bad about it. And then what? And so you just continue to follow down this spiral of, what if, and then what, and then what. And eventually we hit this bottom place of, okay, if all those things happen, all those horrible things happen, I'm still going to be here. I'm still going to be okay. And it can really take the power out of the what ifs. So try to stop the what ifs. If you can't stop the what ifs, follow them with then what, and just continue on until you hit the bottom of that well. And then you'll be able to likely let it go. I also want to remind you that feelings are not facts. Anxiety is a normal human feeling. And feelings are feelings. They don't always make sense. They're not always rational. They're not always based on facts. So try not to be upset with feelings because they're not making sense. They're just feelings. It's our emotional experience. I also want to give you a really important trick that not a lot of people talk about. Anxiety is always related to a loss or a fear of a loss. So if you think about the last time you were anxious, try to identify what the loss was or the fear of loss. If my last experience of being anxious was I lost my wallet, I couldn't find where I had put my wallet, and I immediately became anxious, I need to ask myself, what was my loss or fear of a loss? Well, I was afraid I lost my wallet, which was a fear of losing my money and my credit cards. And then the fear of loss went further. I was worried somebody was going to steal my identity. And then I would have to deal with the creditors and establishing, my innocence of some credit fraud that somebody did with my identity falsely. And I just went down this whole road of the worries. And so if I can see that I'm anxious because of this loss or fear of loss, it actually can settle me back down. Okay, I know I'm worried about those things. Right now I need to focus on finding my wallet. How do I retrace my steps? When we're really anxious, it's hard for us to follow logical patterns of dealing with situations or problems. If we can get our anxiety reduced by thinking, okay, I'm experiencing a loss or a fear of a loss right now, just that knowledge can help your brain realize, okay, I'm not in danger. I don't need to activate this physiology in this alarmed state. This is a feeling of loss or a fear of loss, and it's an emotion, and I can handle this. So try that one out. Think about the last time you were anxious, and can you recall feeling a sense of loss or fearing a loss related to that? If you can, that's really empowering, and it's a tool you can use moving forward. When you're anxious, take a pause and just ask yourself, okay, what's the loss? Because sometimes we're anxious and we don't know why. This is going to give you the answer as to why, which will help you make sense of it. I also encourage people to ride the waves of feelings. When we're anxious, it can feel like we're riding these waves of distress, that it's a tidal wave, it's a tsunami. We're in this swell that's going to knock us over. The fear, the worry, the anxiety, the panic we experience. And it's going to pass. I want to remind you, like the swells and the waves in the ocean, these swells and these tides, they come and they go and they pass and things settle down. And that's true about our feelings as well. If you're trying to stop your feelings, it's almost like trying to stop an ocean wave. Good luck. Rather than fighting it, imagine trying to ride that wave, and we just kind of hang on as tight as we can and support ourselves as best we can and ride it through. Recognize the feeling, watch it pass by. And the goal really is then to be able to ride through all these different waves of emotions that we're going to have as humans. It's normal to have all these different feelings. Try not to be afraid of your feelings. Try to use them. If we're anxious, that's a really important tool to use. Why am I anxious? What's the loss or fear of loss I'm experiencing right now? That's going to give me a lot of insight about what's going on with me, and that can be very, very empowering. So ride the waves of emotions rather than trying to stop or stuff them. Some more tips for you. I encourage you to think about using aromatherapy. There's research that shows that lavender and lemon balm are very calming scents. So try to incorporate those into your life in order to stave away anxiety. Acupuncture has been known and found through research to be very effective for reducing anxiety as well. It helps with stress and tension. Biofeedback is a technique of treatment that is incredibly helpful for reducing anxiety, particularly anxiety disorders. And you would need to consult with a professional who's certified in biofeedback treatment. They connect you to a machine that will give the feedback of your biology. That's why it's called biofeedback. So you'll get electrodes put on you, no needles, and it will measure your heart rate and your muscle tension and your galvanic skin response. And the biofeedback specialist will teach you relaxation techniques, and then you can watch on the grid your numbers come down. So you're getting that immediate feedback about your biology, and the more you relax, the more you can see on the computer screen that you're in a relaxed state. Using biofeedback for a series of sessions is incredibly helpful because over time you won't need the biofeedback sessions. You'll be able to do this on your own, and that's really the goal of biofeedback. Music therapy can be a great tool for reducing anxiety. Putting on calming music or really loud, energetic music as a distraction. Think about music that's going to take you out of your anxiety and have that available to be able to use at any time. I encourage you to use anxiety as your guide rather than being afraid of it, seeing it as this really scary thing in your life that you just want to avoid and never experience again. Try to embrace it, try to lean into it, and think of it as a guide. If I'm feeling anxious, my body's trying to tell me something. It's that mind-body-soul connection that's really powerful if you would just pay attention to it. What is my body trying to tell me about what's going on with me emotionally or what's going on in my world right now? If I'm feeling anxious and I ask myself, what's going on? What's the loss or fear of a loss? I can really use it as a guide to help me understand things that I'm not really paying attention to. And in this way, anxiety can be your friend. It can be a very helpful guide. If you continue to experience a lot of severe anxiety, it's causing that impairment of functioning in your life, it might be wise to get some professional help. And one of the techniques that professionals are going to use is called cognitive behavioral therapy. If you're researching therapists to help you out, you want to make sure that this is somebody who uses CBT as one of their techniques, as it's incredibly effective for anxiety symptoms and treatment. There's also a type of treatment called systematic desensitization, and this is baby steps. And we can do this a bit by ourselves. So if I'm avoiding a situation because I tend to be always anxious in that situation, but I really want to get myself to be able to be more comfortable in that situation, I will take baby steps or small steps toward that thing I'm afraid of. rather than throwing myself into the situation immediately and saying, well, good luck, honey, because you just got to get over this. Just pull up your bootstraps and hang in there and do it. That's not going to be really effective for me and for a lot of people. Rather, I would take a small step toward it. I might talk to somebody about attending that meeting that I'm feeling anxious about, but I'm not there yet. Or I might walk by the room where they have that meeting, but I'm not going into it yet. So what are the small steps you would take in order to give yourself access to those places, situations, and people that you've been avoiding due to anxiety? That's systematic desensitization. Time for you to make a plan. I would like you to review 5 of your anxiety symptoms that I covered. Make sure that you're picking the ones that are really prominent for you. And then write down 5 anxiety reducing techniques that I went over that you're willing to implement this week. Why this week? Because it's time for action. Anxiety is highly treatable, and we can treat symptoms before it ever gets to a disordered level. That's the point. Let's treat the symptoms so we don't develop a disorder. If we have a disorder, we can still use these as techniques. Write down those 5 techniques you're willing to use this week, and then share them with a trusted friend or colleague, and make a commitment to check in with that person in order to see how you're doing. And that check-in is a way of accountability. It's a way of making sure we're following through and following this plan to feel better. Sometimes it's hard for us to focus on self-care and put ourselves first and take the time and space to really do those things that are going to help us feel better. I really encourage you to make a plan now. You can do this, so do it. The bottom line is that there is a very strong mind, body, soul connection, and when your mind is starting to race, your body will respond. That connection is so powerful, and it can be distressing, but it also can be empowering because you can use your body as a scale to let you know how you're doing. Anxiety is a normal feeling. It can help you, and it can be managed. I really hope you'll follow through with some of these tips and tricks for reducing anxiety that I've shared with you so you can experience living a copacetic life.